All right, Quinton, thank you for coming on. Very nice to meet you.
Thank
Welcome
you
to
for
the
having me in, son.
podcast.
Yeah, man.
So, we've got a lot to get into. All right, so before we get into anything, do you want to just break down your background and how that shaped the way that you look at exercise and coaching?
Yeah, man. Probably a longer story because I'm one of your probably older people on the show. But so I started getting into fitness. Like my dad got me into it when I was really young. So I was always into sports. And my dad's a big dude. He's like 6'5", 250. He's always been pretty jacked. Played college football. Sports was kind of my introduction to fitness, trying to get better at performance, right? So my dad started taking me to the gym when I was like 12 years old, nothing crazy, once a week, just kind of teaching me how to move. And then once I was in high school is when training really I really had no interest in school when I was younger. I was pretty much playing sports. That's all I cared about. So I ended up going to college to play football in track and field. I started down in Santa Rosa, California, and played football and track there. And then I transferred from the junior college up to Simon Fraser University, which is up in Vancouver, Canada. And I got a scholarship to play football up there from the junior college. So went there and played for a year. I was majoring in kinesiology and biomedical physiology. And that particular major was kind of pushing me more into like a clinical setting, which I wasn't. I was excited to train people. So I wasn't like super thrilled about kind of going the physical therapy route. So I transferred to Central Washington University, where I kind of continued in track. I kind of let go of football at that point, but they have an exercise science department there, which was like right up my alley. It was kind of fun how going from getting a pretty crappy GPA in high school to like once I started learning about the things I was interested in, I was on the dean's list, getting, pretty much straight A's and loving learning about physiology, exercise, all that. And then, so one of the blessings in going to three different colleges is I had three different football coaches, three different strength coaches, three different track coaches. So I got to really hear different languages of how to train, different methodologies, some telling you the same thing, but in a different way. And that I think really benefited me long term with how I train people, because I've been able to maybe say things in 5 different ways so that one person can kind of get the one way that they learn it, So after I graduated with my exercise science degree, my big goal was to just kind of start my own training business, training athletes. However, I didn't have any knowledge on how to start a business. So I kind of stalled out after college. I went back to like serving and bartending and kind of lost my drive to train because I wasn't competing in sports anymore. So I'm like, why am I even training? So I kind of went sedentary for like 2 years and kind of had to re-find motivation to train. I mean, meanwhile, I was training. So like I kind of bounced around jobs. So I was always serving and bartending as my main income for a while. And then I got an opportunity to be the strength and conditioning coach at the high school I went to for the football team. I did some off-season conditioning work for the lacrosse team. And then I was also helping out coach track and field at the time, which kind of re-sparked my passion for trainings. I did that for 2 years. And then I got an opportunity to become a PE teacher for kindergarten through 8th grade. So I kind of took that up. And so I was
The great
basically,
descent route.
yeah, so I was kind of doing PE and youth sports and bartending. And then I was picking up, the school kind of took a lot of my time. So I dropped coaching at that point. And then out of nowhere, there's a gym on Bainbridge that I've since worked at called Island Fitness. And the fitness director there reached out to me just because he had heard through word of mouth that, I was helping kids out and stuff like that. And he's like, hey, we want to kind of come up here and be a trainer. And I was kind of reluctant at first to like go into the general population setting because that just didn't seem exciting to me at all. But I think I kind of, said, sure, I'll give it a try. And then I went there. So I guess prior to all this, I also got my certified strength and conditioning specialist, my CSCS, which I think as far as, certifications go, is one of the top tier ones you can get just because you need a college degree to even take the test. And then the passer rating for that's like 50%. So like half the people that take it fail it. So that was like a huge goal for me. And I got that. And then when I went to Island Fitness and started working there, every trainer there has this certification called orthokinetics, which is something that I've been using a lot in my training. And it's essentially a way of analyzing someone's body to look at all their different ranges of motion. So it's like a 3-part assessment they teach you to do, where you first, you talk over their goals, their history with exercise, talk about any previous injuries, surgeries, joint limitations, muscle tightness, weakness, pain.
Does it
And
do
I
anything
should
like
say
an
that
FMS?
kind of, yeah. So it's like, so we go from like a general intake form, kind of just getting to know each other, their goals and so forth. And then the second part of the assessment is like a postural assessment, where I'm basically having them stand in the middle of the room. I'm looking at all their joints. I'm feeling for different bony landmarks and looking for subtle asymmetries or big deviations from what we might consider to be ideal posture, right? And that will kind of give us some clues as to maybe which exercises will benefit this person the most. And then the second or the third part of the assessment is kind of a combination of range of motion testing. So I kind of, take them through every joint's range of motion, and I'm looking for asymmetries in movement or limitations in movement. And then we go into a functional movement assessment, where I look at their basic push, pull, squat, lunge, flexion, extension, rotation. And I kind of see if those subtle or big range of motion differences or postural issues kind of affect the way they move. And it just kind of helps you develop a well-rounded program to kind of get this person going in the direction they want. And I should say that 80% of the members at the gym I work at are over the age of 50. So I train a lot of older people that really their goal isn't hypertrophy, right? I mean, I kind of have to sneak that in because I think that's a really good thing for most people to train for, is just getting more muscle on their body for longevity purposes. But a lot of it is just kind of fixing tight areas, joints that have limitations, So that's kind of where my work experience has really just kind of evolved. I've worked with hundreds, if not thousands of people now, assessing hundreds of bodies. I've kind of seen it all, work with people, hip replacement, joint replacements, all these major issues. And through that, I've been able to develop really good relationships with a lot of the physical therapists in the local area. And so now I kind of just get referrals from PT, sending guys when they're done with PT to now continue their fitness progress with me afterwards, which has been kind of cool because it kind of helps bridge that gap between, well, you go to the PT to get fixed up and now you're done, you're good to go. But it's like, now we should maybe try building up a more robust, body in order to live longer.
I actually had a very similar experience. The last gym I worked at, we had like a PT office that was connected to the gym, and majority of the clients that I had there actually were senior citizens, and it actually changes your perspective so much, especially to be like a young person and to go into being a personal trainer like while you're in school, thinking that you're going to be coaching your peers and kind of like sculpting these bodybuilding physiques or finding powerlifters. But in most real life settings, you're going to be dealing with regular people with, for lack of a better term, like regular goals. To some people like on the internet, it doesn't seem crazy to want to maximize the recruitment of your rear delts, but to somebody on the street, they're worried about just walking up the stairs most of the time.
Yeah, 100%. So it's kind of that whole functional training, right?
Yeah.
It's like, it kind of gets a bad rep, but when it comes down to how do we live as long as possible?
Yeah.
Cardiovascular health, having a decent VO2 max is going to push you that much further out. Having more muscle mass protects you from all types of diseases. It helps you if you fall. Any recovery that you need after an injury is going to be way quicker if you're strong. So those two things right there, yeah, sure, it's great to have an awesome looking physique, right? But if like internally you have big limitations in range of motion and you have, issues at certain joints and you kind of push past the pain and it becomes a nagging thing over time, it's like, let's see if we can get to the root of this issue so we can continue to train the way we want to for as long as possible.
And the longer that we reinforce like bad movement patterns, the harder it is to rewire them later on in our life. And that actually leads into a lot of stuff that I want to talk about later in this episode. I don't know if you wanted to go into the Marshall papers if you're interested. Marshall from 2022, the monkey paper on flexible control of motor units. I wanted to ask you a couple of questions about that. But before that, I was just curious. It seems like you didn't really work in like a gym floor setting until quite a bit into your career. Is there any reason for that? Like, did you originally kind of want to avoid that like gym floor experience, or did you really want to work more with athletes? Because it was so different for me, being somebody who like never played sports my entire life. I came from being like very overweight. When I first got into coaching or wanting to make this some type of a career for myself, it was purely out of vanity, and it was for bodybuilding. I wanted to make people look good. I wanted to look good, and I never had that kind of athletic connection, and I was just
Mhm.
curious at like how that shaped your pathway in your career and maybe the decisions that you made.
Yeah. So, yeah, you're totally right. Like, my whole training background is based off of performing better at the sports that I played, right? So,
Yeah.
and it's tough when you're doing two totally different sports. Like football, I played quarterback. So it's a lot of footwork, some agility stuff, but it's a lot of mental training too. And then track and field, I was a thrower. So I did discus, shot put, hammer throw, indoor weight throw, some javelin. When I was younger, I did a lot of jumping. So I'm kind of more of a power explosive guy. So I was always trying to get a higher vertical. I was always trying to get a heavier power clean, all these different things that were more performance based. And when I kind of when I was done with college, done with competing, my body was wrecked. Like, especially doing a lot of big unilateral movements like discus, shot put, hammer throw, you're rotating one direction, throwing heavy shit. And my hips were all messed up. My back was all messed up. Like, my leg length discrepancy in college was like an inch and a half. I'd go to the training room before every practice and we'd do all these hip exercises to try and, it's not like
Mine
my
too,
legs were.
actually. Mine is exactly the same. I screwed my disc up when I was like 16.
Yeah. So like I was constantly battling my body to compete. Um, and it's hard to unwind all of those things when you're in season competing. So when I got done with college and I kind of went through this spurt of not wanting to train, kind of lost my drive. The reason I actually got back into training was because I proposed to my then girlfriend and I had like a year to get ready for my wedding. And I'm like, okay, I cannot be 245, at 35% body fat on my wedding day. So that was like my big drive then, kind of switching from sports performance to more like a vanity type of I want to look good, right? So that's what really kind of drove me down the hypertrophy route because yeah, I wanted to look good in college, but it was more about how explosive could I be? So kind of then transitioning to researching hypertrophy studies and looking at like, okay, well, what's the most optimal way we can get, hypertrophy is kind of what has shifted my personal goals now. And I should say too that when I first started working at Island Fitness and got the orthokinetics certification, which takes like 500 hours of long-term hands-on stuff, like working with different bodies to really get the process down. I was able to basically fix all my asymmetries and like I could rotate like crazy to my left and I was super tight going to my right. So the way I kind of approach corrective exercises, not just for muscular imbalances in size, but like range of motion differences is basically throwing a little bit more volume or work on the side that needs it. And, we're still making progress with both, but hopefully that side that's weaker or more limited can kind of catch up. And you reassess from time to time to see if we're getting closer to, even ranges of motion. Like every joint has kind of a degree range that it needs to meet to be considered like a normal, healthy, functional range of motion. So I really just attack the big limitations or big asymmetries. And I find that normal bilateral training for a lot of things can tend to kind of even out over time. But long story short, I was able to kind of fix my issues and then focus on hypertrophy after that, which is kind of what I've been doing the last few years is trying to, I'm 36. I want to put on as much muscle as I can while I can, just so that I can keep doing the things I like doing for as long as possible.
You're 36?
Yeah, man.
What? I thought when you were saying you're older, I thought you meant like late 20s or something like that.
Nah,
See,
36.
I
Yeah.
did that. You're almost double my age. That's crazy. I'm
Wow.
20.
I know. I get these moments like when I'm talking with people online, I'm like three times this kid's age. Or like, I'm like 20 years older than this kid.
Wow.
It's wild. So I want to stay young and as explosive as I can and as strong as I can for as long as possible. Now that I just had a son 4 months ago too, it gives me a whole new kind of motivating factor to stick around as long as I can,
I feel, but when you were talking about like improving range of motion, would you say that the solution to that is fairly simple in the sense you really just want to expose the muscle that has that issue to just more and more lengthened positions over time? Would you say that's really it, or do you think there's more to it?
There's more to it. I mean, that is kind of in a very small nutshell what it would be. But like, for instance, take hip flexion. If I have someone lay on a table and slowly actively range or raise their leg up till their end range, some people will feel tightness in their hamstring because that's the limiting factor. Some people will feel like a cramping sensation in their hip flexors and rec fem. So like they could be limited in range of motion because of a tight area on the opposite side, or they could be limited in their range of motion because of a weakness on the side that's actually performing the movement. So sometimes if like, for instance, they feel their hamstrings tight, well, I want to do some kind of dynamic hamstring mobility work. Or when I'm doing hamstring curls, I'll have them lean forward to expose them to that lengthened position a little bit more. And so, yeah, it's like with anything, if you're trying to increase mobility, you want to tiptoe just past what you're normally doing and then tiptoe a little bit more, tiptoe a little bit more until you're at a normal, healthy range of motion and it's not, screaming at you anymore.
In what instance would you incorporate something like static stretching?
I'm
Not
not,
often.
I'm not a huge fan of static stretching unless you, like, I think of it as like, okay, well, if you live a sedentary lifestyle and you're watching TV for hours a day, like I would say like during the commercials, that's a time to do
Yeah.
some static stretching, like try to find a way to sneak it in.
Yeah.
But I'm not going to say sit down for an hour twice a week and static stretch the heck out of everything. I think you can get just as much benefits, if not more, when you're working active range of motion and trying to get just a little further than you were able to previously. And over time, those little millimeters or degree changes add up to a lot, just like progressive overload on lifting weights, you just
Yeah.
slowly tack on a little bit more, expose yourself to those, increased stimulus, and then, build up from there.
Yeah, I definitely not for the reason that most people are big proponents of static stretching, which is like stretch-mediated hypertrophy, which I definitely wouldn't suggest would be like a optimal way to maximize those gains. But if you wanted to use static stretching, like for a lot of my clients, I'd use it for kind of like a nervous system adaptation so that they could become more adapted to longer range of motions, or like spending more time in certain positions and kind of like trying to progress that range of motion as opposed to like trying to progress with weight. Just if you can only do like a seated hamstring stretch, maybe you can only reach your toes, trying to reach a little bit past that. Would that count as some form of progression, or would you always rather just do loaded training in more lengthened positions?
I mean, I think there's definitely some merit to some static stretching if you have the time, but it comes down to like if I have an hour to work with a client, I want to get the most bang for their buck there, right?
Right.
So I guess the way I kind of organize a lot of my sessions would be if I've done an assessment on someone and let's say they have tight hips, because most people have a limitation in hip extension because their hip flexors are so tight. I want to basically start the session off by priming the movements that they are limited in. So if I wanted to increase their hip extension, I might either do kind of some glute work to start, or if it's a hip flexor limitation, I want to dynamically get that hip flexor to be desensitized to being lengthened out. That way, when we go into the resistance training, now they have access to that new range that we can get strengthened. I guess it's kind of along the lines of we want to prime the limitations by exposing them to a little bit more range so that when we do the resistance training, we can then cement that new range with strength a little bit. And we just kind of progress it from there.
So how long have you been working at a gym at this point?
So I'm coming up on, I think I started there in 2017. So it's creeping up on 8 years now, the same place.
Do you see yourself working with clients in person for the rest of your life? Do you think that's kind of your favorite of the things that you've done so far?
I think on a smaller capacity, yes. So another thing I haven't talked about is there was a big need. So I started helping out with a class at the gym when I first started there. It was more of a Parkinson's oriented class specified for like more specific for people with Parkinson's disease because we had 4 or 5 members that had it and they wanted to kind of get a group together. So I started helping out with that, and then word of mouth spread and it became this big class. And through that, I was able to get a lot of clients. So I ended up getting another certification through the American Parkinson's Disease Association. So I'm like also a Parkinson's exercise specialist. So I have a lot of clients that I think helping those people is one of the most rewarding things that I do. Like helping someone get a bigger bench press or helping someone get a vertical jump it's rewarding. But like when I help someone, not fall or like avoid potential life-threatening issues. And then also there's a community aspect to this. It's like a support group for these people that are all working through the same thing in different ways. I am very rewarded by some of my clients, but I think now that I have a kid and I'm going to start dabbling in the online coaching space here pretty soon, which is something I wanted to do for a while, just haven't really gotten around to it. And I've been looking, there's this podcast I kind of listen to called Barbell Logic, and they're kind of one of the leading industry or industry leaders in what they call asynchronous online coaching, where essentially it's an app that they've built. It's called Turnkey Coach. And it's essentially like an app where it's asynchronous. So like I can do the programming for someone, they do their exercises and record their working sets and upload them to the app. Then the next day I can review their exercises, give them, critiques or cueing, tactics, things like that, and then kind of keep programming them. But we're never really talking one-on-one. It's more, you do your workout, I give you a 10-minute video feedback, which would allow me to work with more people in a shorter amount of time. And then it's on a subscription base. So like I'd be bringing in money monthly as opposed to
Selling
if
your
someone
time.
just,
Yeah.
yeah, exactly. So that's kind of where my head's at right now is how can I optimize my time and still financially support a family now?
Yeah, because if anything, it would probably be ideal for you to have those in-person clients, but then not have to depend on that for income. Yeah, because
Yeah.
that's where
So
it
if
gets
I could,
tricky.
ideally, if I could like train in person like a couple days a week and then
Yeah,
do the rest online, that would be great. Because
that's the
going in
dream.
person, the ceiling is how many hours can I work, right? And then the other ceiling is how much can I charge for an hour, right? So when I first started training, it was like 65 bucks, 70, and I kept getting raises. And now I'm at like 120 bucks a session, which is great commission and everything for me. But I'm still training 35, 40 hours a week, which is, it's a lot. It's mentally a lot too. And there's a lot of extra work on the outside that a lot of people don't think about with programming and things like that. So right
Yeah.
now I'm trying to optimize my time and kind of maybe gravitate towards the online space.
So I was going to ask, how does your training with clients with Parkinson's differ from like your average like senior citizen program?
So like the way I think of Parkinson's is it's a movement disorder, it's a neurological disorder, and it essentially, the symptoms that come with it for the most part are things that most older people are going to encounter at some point anyway. Fall risk, balance issues, things like that. There's the tremors and stuff too, but not everyone has them. Parkinson's affects everyone differently. There's like a big spectrum of Parkinson's too. So my strategies for training someone with Parkinson's don't differ that much, aside from the fact that you have to be very cautious with the exercises you give them as far as fall risk goes, because the last thing you want is someone to get hurt when they're trying to get stronger. So I find that very stable machines, leg press, a lot of machine work really helps them get their strength. And then the class I teach is more cardiovascular involved. So there's been a lot of studies showing that. So Parkinson's essentially is just a sped up aging process. So like you get Parkinson's, you're going to start losing your balance quicker, and therefore you're going to be sedentary more often, which is going to make you atrophy more, which is just going to cause a lot more issues. It's this kind of
They compound on each
snowball.
other. Yeah.
Yeah. So it's essentially everyone's going downhill when it comes to muscle after the age of like 50, right? So like if you're diagnosed with Parkinson's, that decline just going to happen faster. So you have to be that much more on top of staying strong. And so there's not a ton of science or research on exercise in Parkinson's. They're doing studies now and they're coming out with some. But one of the best things you can do for Parkinson's is making sure their heart rate gets above like 80% of their max heart rate for like an hour, 3 times a week. So I do kind of like it's called POP. It's Punch Out Parkinson's. It's like a kickboxing circuit class where they're working on big movements. Cause that's the other thing with Parkinson's, their movements become really abbreviated. Like steps are way shorter. They end up stumbling a lot more. They just don't have the ability to do dynamic things. So working on big movements, big steps, getting their heart rate up. So I have like, battle ropes, heavy bag, speed bag, focus mitts, medicine ball slams, just things that anyone could take the class and get a cardiovascular benefit from it. It just comes down to being very attentive to who's going to fall and then trying to make accommodations for people that do need a walker and things like that. So it's like training anyone, but on a, I guess, more delicate and being more. That's the other thing is they can swing up and down like crazy. One day they'll be really good and they'll be super balanced. So you kind of have to attack the day and meet them where they're at.
Do you think those like limitations in their movement and range of motion, do you think the majority of that is like set or like predetermined by the brain? Or do you think it's kind of like an emotional response, possibly? Or it could have something to do with just the way they're feeling at that point in time?
So the big thing with Parkinson's, it's a dopamine deficiency. So their brain, the area of their brain that actually processes and uptakes dopamine gets the neurotransmitters get affected, so it can't uptake as much. So they end up taking a medication that helps dopamine production. So it kind of oversaturates their brain with dopamine in the hopes that it'll diffuse better. But over time, they become more and more resistant to that and have to take more and more and more. And so they have this, a lot of people with Parkinson's, when their medication's working and they're good, they call it they're on. So like they're pretty functional. They can do most things, but if that medication dips or if they're in between, medication, when they're taking it, they can be a completely different person. Well, it's and there is a psychological component to it because a lot of people when they're first diagnosed, depression hits, they go and look at all these videos of what does Parkinson's look like, and they see all these people falling and stumbling and all these tremors, and that's hard to handle mentally when you get that diagnosis. So I think it's a combination. They don't really know what causes it either. It could be there's been some studies that have shown like people that live within a 3 mile radius of a golf course growing up, that has like a 40% increased likelihood of getting Parkinson's based on like the groundwater and all of the fertilizer that golf courses use. But it also seems to be somewhat hereditary. It tends to run in families too. So it's kind of unclear whether or not it's more environmental or more hereditary. It's just a challenging thing to deal with. So to be able to help that population has been really rewarding for me.
Yeah, I mean, to see that just it leads me to so many questions because, like, especially in light of like the recent literature that everybody's been going over, like, I wonder if they could possibly be like recruiting different motor units in those situations where the medication's working well for them, and maybe in situations where it's not, they could be recruiting different motor. Do you think that's something that's possible or no?
It is. It's interesting. Like there's a lot of like there is some sort of like psychological component to it because when you have them like say walk in a straight line, they may have one step every now and then that just their foot like sticks to the ground and they can't get it off. They like kind of stutter, and then they can go again. But if you put like a ladder on the floor and have them like step, 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 like their brain automatically clicks in and there's no hesitation. They can walk upstairs perfectly if it's like in a rhythm. So it's fascinating to think about like what happens when the dopamine is low and how does that affect movement. And I'm not going to pretend like I understand the crazy neurophysiology behind it, but certainly just like anyone at the age of 80, like if you're strong and you have the ability to recruit more muscle fibers, you're gonna be better off, right? So I find that
In every
sometimes
imaginable
they'll,
way. Yeah.
yeah, like sometimes they'll stumble in and kind of get through the session and then they start moving better. Like I throw them on the leg press, have them really work, and their brain has to recruit as much motor units as possible and I get them close to failure, like anyone else. Then they get off the machine and they're walking smoother. So like it's almost like you're jump starting that system to help them move better, which is kind of interesting. But I think it's kind of the same with anyone who has been sitting around in a sedentary lifestyle for a long time. You get them in the gym actually trying to go close to failure. All of a sudden, these motor units that haven't really been recruited in a long time now are like, I'm still here. I can still fire. It just helps everything.
Yeah, and I'm sure a big aspect of it too is just getting them emotionally in a comfortable enough space to even want to push hard enough because they're probably so afraid of all the things that they see when they go on the internet and
Yeah.
self-diagnose.
And when you fall like twice a day on a regular basis, you can be very fearful of moving. So, like, even just the trip from the couch to the kitchen can be kind of daunting for them. So, to some degree, a lot of my work is building trust with these people in order for them to trust that I'm not going to let you fall. Even if you do, I'm going to dive underneath you to break your fall. Just being attentive to them, listening to how they're feeling. I'm not trying to, like a drill sergeant, say, no, we're doing this today and you're going to push yourself like crazy. It's kind of meeting them where they're at, but finding ways to sneak in those challenges. And for any client you have, there's a moment, I think, um, if they're coming in regularly And it takes a while for them to really feel the difference training makes in their real life, right? But like if I'm training an older woman who's never worked out before and she's like, I don't know about this whole weight training thing. And I kind of build some trust with her. I work with her for a couple months. And then all of a sudden she's like, so I was gardening the other day and I picked up this plant that I remember being really heavy, but now it's like, it was easy. And I'm like, see, like that's when you really start getting that. You're almost proving your value in what the whole, trying to get adaptations is. And I always try to, I think being someone who works with a lot of people that are completely uneducated in fitness at all, it's how do I find ways to explain this stuff to them in ways that they'll understand? So like one thing I always say is like, we don't come to the gym just to work out. We're coming here to like trick our bodies into thinking life is harder than it is and forcing these adaptations to happen, right? So like, yeah, coming to the gym for an hour and pushing heavy weights seems like a big hurdle, but when you feel the difference outside of the gym in your real life, that's when they really get hooked almost. That's the goal, is to get them to do this on a regular basis and have it not just be a new thing they're doing, but a lifestyle change.
They have to come to the decision on their own that this is more beneficial than sitting on the couch. Like that's the mistake that I feel like so many coaches make, is that they end up discouraging their clients from the community that they want them to be a part of. And I think, I mean, it has to do with, I'm sure, just like the mentality of being in a gym and just the kind of fitness culture that kind of scares a lot of these people away. And I feel like that's, if you really are a coach who cares about making progress and cares about your clients and you really want people to see the results, then you kind of have to, like we were talking about, come at them at the level that they're at. Because if you're coming at it with your own predispositions, you're going to end up scaring them away from the gym, and you could end up ending their life prematurely because of that, indirectly.
Yeah. So I think it's interesting. So the way when I'm doing an assessment on a new client who's never been to the gym before, it's my job to prove to them that it's worth what they're doing. They got pushed into the gym by their wife who goes, and the husband's like, I don't want to do any fitness stuff. So they're already reluctant coming in. And I have to, in that first hour, prove to them that this is something that's worth doing. And that's why I think the whole orthokinetics thing is pretty cool, because when I'm doing a postural assessment on somebody and I'm feeling their shoulder blades and I'm like, oh, this right shoulder blade's like about an inch higher than the left. And they look in the mirror and they're like, oh, I never noticed that before. And then we get into the range of motion testing, and like, they're like, yeah, I got this shoulder. It doesn't really want to go any higher than this. Then I'm kind of, the level 2 part of orthokinetics is what's called neuromuscular stability testing and treating. So like, for instance, like if someone's limited in shoulder external rotation, that's going to be something you want access to if you're going to be doing any overhead movement. So like if they're, say, stuck at like, I don't know, here, what I can do is I can kind of manually put resistance on that action and make sure they're not compensating with anything else to get there. And literally in like 30 seconds, have them, just get that muscle to fire the right way, and then back them a little further into it, push against them, back them up a little further, push it against them. And I can show them in real time, like, see, in 10 reps, I got you from here to here.
But you're pushing them into or out of external rotation?
So I'm pushing them into internal and they're fighting against me.
Okay.
Yeah. So like, I'm just trying to wake up the muscles that perform that action. And sometimes just doing that for like 10 quick reps can unlock 5 degrees of range of motion. And I'm like, see, like right there, we just got you access to a little bit more. Is it going to stick? No. But if you're doing it repetitively, and then we can get you to this normal, healthy range, now, first of all, you're probably going to have less pain in that joint, especially when you're doing overhead movements. And it's just kind of a tool I use to show value, right? So like, imagine 10 reps just got you 5 more degrees. Imagine what 1,000 reps over the next month is going to do,
And would you say once they get past that point working with you, and then they just transition to like exercises that work those joint actions, like an overhead press or something like that, they're not going to have to continuously work with you in that context, and they can kind of just use those movements as a substitute to remain with those adaptations?
So I guess when I'm doing like the manual work on someone, like by manually adding resistance to certain joints, I almost use that as a primer to then get them into an exercise that will work the joint action I'm trying to accomplish, right? So, okay, if we can't get here, let's see if we can fire that muscle up manually, get it working, and make sure they're not compensating with any other muscle, which a lot of people do. And once they kind of, okay, yeah, are you feeling it back here? Yeah, good. And then we kind of go to cable external rotation. And then I'm starting to say, okay, so when you hit your end range, that's not your end. Like I want you to hit your end range and see if you can squeeze just another millimeter out of yourself, because that teaches them how to actually engage. A lot of people do not understand how to try hard. Like that's the hardest thing, is getting someone to try hard. And pain is something that will keep people from doing things, right? It's our body's protective mechanism to like, oh, this joint hurts, don't do that action. But when you say, okay, it hurts when I come into external rotation, so I take you to a position where it doesn't hurt and have you work it here. And then all of a sudden we're gaining a little bit more, we're getting a little bit more. Then you go do that exercise and they can get out without it hurting. Then all of a sudden it's like, oh, there is something to this. Maybe I shouldn't avoid this movement anymore. Oh, it's like it hurts because it's weak. And anytime you're reaching the back of your car, it's going to flare up on you like crazy. Let's make you more resilient to that range. So you don't have to periodically go to a chiropractor to get fixed or go to a physical therapist to get fixed. It's like, let's get to the root of the problem, strengthen the muscles that are terrible on you or weak, and improve.
So I know I'm asking too many questions about this because I have so many other questions about the other stuff, but how important is like RIR or intensity when you're doing these like corrective exercises? Like,
Yeah, so I'm not necessarily pushing them to failure. I would say, so first off, I want to test their active range of motion. So if they can actively get to like 85 degrees of external rotation, I want to see if I can improve their active range of motion. So I'm just basically taking them and I'm seeing where they're stable at. So I'm going to apply pressure at that end range. And if they're really weak up there, I'm not going to ramp it up at that point. So I'm going to take them a little further into their comfy place and have them really fire there. And usually doing that unlocks a little bit more strength up in their limited range. And over time, it's more just like, can I wake that area up and then go train it and then progressively overload that exercise? It doesn't take long to like, depending on depending on why they're limited, to get them to improve their range of motion to at least a minimal range that they need to be able to, do the exercises comfortably and stable.
do you think like that active range of motion has something to do with the length tension relationship, and maybe these people being inactive for so many years, like it could have like shifted their length tension relationship so that their plateau is a little bit higher?
Yeah, 100%. The whole thought of like only certain muscles can benefit from stretch-mediated hypertrophy, I think like in a perfect human that has healthy range of motion, that's probably true. But like if you live on a computer and your pecs are shortened all day long,
Yeah.
they're going to have, yeah, less ability to be strong in a lengthened position. So you have to expose them to that. And do you do that by stretching their pecs, or do you do that by rowing and getting more retraction? It's
Probably
a
both.
combination, and it's dependent on where those person's weaknesses are,
Yeah. Wow. All right. So I do want to touch on Marshall et al. From 2022. Because it is getting very popular, and I know you made a couple of videos on it. This was like literally the hardest paper I've ever tried to read at least in the TikTok community so far. Like this is the hardest one that's come up. But what I got from it is like the basic setup is that they recorded single motor units in the deltoid, triceps, and pecs of a monkey while the monkey tracked different force targets, and they also micro-stimulated M1, which is the primary motor cortex. So, to my understanding, they found three pretty wild things. One, different cortical microzones in M1 drive different motor unit subsets inside the same muscle. The second thing being recruitment looks size principle-ish only during slow ramps, but completely falls apart during high-frequency tasks or when the muscle length changes. And then the third thing is that a single common drive can't explain motor unit behavior, and they needed 4 to 6 independent drives per motor pool to model it. So to me, that points pretty strongly to recruitment being task dependent and multidimensional, and it's not really like a simple moment arm to EMG output. I find this to be extremely interesting though, because this paper is years old and we're just talking about it now. So I have a couple questions. First of all, how do you interpret this paper, and does it align with the perspective that you had on recruitment beforehand, or do you think that this has changed your perspective?
Yeah. So as you said, the paper is very dense. But I guess when I was listening to it, it was interesting because for a while there, the whole neuromechanical matching thing seemed pretty appetizing. Like this is a pretty simple way to explain it to people, and it sounds really good and smart. And to be
It's
fair, I think,
TikTokified.
Yeah,
It's very
it's easy to
easy.
follow.
Like,
It's
yeah.
catchy. I think so. I think neuromechanical matching did a lot of good things for the community that a lot of people don't talk about. So many people know joint action. So many people know all these terminology that helps me when I'm talking to someone. Because when someone says like, "Oh, it hurts when I lift my arm," like lift it into abduction, lift it into flexion, when like all these different things. So people understand terminology way better, which is great. And I also think if you do train based off neuromechanical matching and you're trying to train all these different muscle actions, it's not going to hurt you. You're not going to get terrible gains from it. If you're training with intent, like, there's big pillars in training that if you satisfy those pillars, you're going to get great results. Um, and now when we talk about the top 3% of gains, there's a lot of debate up here with like, what's the most optimal way to do this and that, which I kind of enjoy playing around in that 3% range just for fun. But this paper essentially, yeah, it kind of told us that it's not as simple as whatever muscle has the best leverage is going to get the most recruitment from the brain, which to me, I had a hard time digesting the fact that how does the brain even know which muscle has the best leverage? And especially when there's like 6 different muscles that perform that action. So the fact that it's more task dependent makes sense to me, especially coming from a strength and conditioning specialist background. We kind of already know this, that if you train for power, the velocity and the force production, you're going to get a different adaptation than if you train for, say, hypertrophy or endurance or mobility, right? So that made sense to me. And it does kind of convolute things a little bit like, okay, well, for hypertrophy's sake, what do we do now? Like, do we want to vary the tempo to get more motor units recruited? Do we want to base everything on the length tension relationship you know, but I think, and there's also this thought like, so do we just want to go back to like confusing the muscles to get as many like switching exercises every other session to like hit different motor units in different positions?
If you reduce it, that's the logical conclusion you come to on the other side.
Yeah. So I think what it showed was that when there's higher velocities, and you can kind of see this. So in the slow ramp, one motor unit was able to take care of it. The other thing about this study that I think is overlooked is that this monkey's not anywhere close to failure. He's not really actively pushing as hard as he can. But what we can tell is that when the force needed to be quick, the motor unit that was probably a little bit higher threshold popped up first, right? Uh, which kind
Some
of
of the
makes
lower
sense.
ones were skipped entirely, I believe.
Pretty much, yeah. So
Yeah.
like the slow ramp, you could see the higher threshold one kind of almost asking like, "Ooh, am I needed here?" But it wasn't. But then the other thing that made me think is like when the monkey can see the future things he needed to do, right? So he could see the wave coming. I wonder if knowing that you need to ramp it up quicker somehow allowed for that flexible control of motor units to being like, I know I'm going to have to hit this harder, so we might as well, after the third sinusoid, just fire the higher threshold one first. It's just kind of interesting. And so it made me think of like, well, as we get close to failure, a lot of the times when you're grinding out those last couple reps, to some degree, you are doing kind of a sinusoid where you're like at least ramping just to kind of get those last few repetitions out, which totally makes sense with stimulating reps model. Like as you get closer to failure, you're going to be firing more motor units. Now, is that completely dictated small to big, or is there some flexibility there? And I think there's just more flexibility than we probably thought. And I was talking, actually, Dr. McMahon was commented on one of my videos and he was telling me, I was thinking, okay, well, if we're going to do a set of 8 and those first 4 reps aren't going to be very stimulating, should we might as well just go crazy, explode on the concentric so that we can kind of skip some of those lower threshold and get to the high ones quickly? He was saying that for force production and athletic training, that is a good thing to do. But what they found is that with explosive movements, you're not really going to be getting a ton of mechanical tension, essentially. So you're essentially the
Even when the weight's heavy?
contraction. So if the weight's heavy, you can't forcefully move it fast, right?
I thought it was just the intent that mattered. Like trying to move it fast.
Yeah, I guess so. Yeah, I don't know. So like let's say we're doing a set of leg press, right? For a set of 8. Going in the first 4 reps are going to be non-stimulating or like not close to failure. would it make sense to just frickin' explode out of the bottom? What he was saying was that in fast contraction, where the muscle fibers have to shorten quickly, there's not enough, what does he say? It's like excitation coupling can't really occur there. So it's like you may not get any additional hypertrophy benefits, but as far as power benefits and force production benefits, you will get. And we know that as we get older, usually the first muscle fibers to atrophy are those type 2X muscle fibers that are more fast twitch, right? Because, and my theory on that is, when you're young and you're a kid, you're running around, you're jumping all over the place, you're activating those on a regular basis. But as we get past college in our 30s, 40s, I think I saw some statistic where it was like, once you get over 50, like 80% of people never sprint again. They never run full speed again.
You're going to be standing though. You're going to be walking, doing a lot of low intensity tasks.
Yep. So those type 2X muscle fibers tend to atrophy, and the intermediate muscle fibers tend to adapt more to those endurance. So you're always moving towards those type 1 adaptation. So my thought was like, even if I can't get a little bit more hypertrophy stimulus from those first 4 reps, we might as well try to keep those fast twitch as long as possible and, be explosive with it.
Yeah, I think that has some pretty interesting implications. I know I was talking to Biomechanics Center. I'm not sure if you're familiar with Ali from Biomechanics Center. He actually, we were talking and he made it seem like it was possible that stimulating reps model might be a little too oversimplified in the sense that during higher rep sets, if we go just based off the EMG readings of like amplitude and frequency, it seems like it plateaus actually a bit earlier during higher rep sets, which could suggest that in sets with muscles that are more distal, it could be possible that like they experience more stimulating reps because they reach the activation threshold earlier. I'm not sure. I don't want to speak on it too concretely just because I didn't do any of the research behind it, but I know from speaking to him, that was one of the conclusions that he came to. And I was curious if you heard anything about that or had any opinions on that.
Sorry, my wife called me in the middle of that. You're saying that in a 15 rep set, the more distal muscles are going to get closer to those stimulating reps earlier?
Yeah, that's what the implications were from the conversation I had with him. Yeah, I'm not sure exactly on the evidence to support that though. I just was curious if you heard anything about that.
I haven't. I guess it kind of makes sense. I know that when it comes to,
because they're more fine tuned.
Yeah, like neural drive to more distal regions of the body, the speed at which the signal gets sent is much faster than muscles that are more proximal. So that kind of makes sense that maybe they would get to a stimulating rep a little bit quicker. But I haven't really dove into that at all. It's interesting though. And I certainly know, like, depending on the sport you're playing, I'm thinking from a, strength and conditioning specialist background, depending on the sport someone plays is going to very much dictate their rep range, right? So like if you are playing a sport that requires a lot of endurance, I may give them sets that are going to intentionally accumulate more metabolic byproducts so that their body is kind of accustomed to that in their training. We can still get close to failure and we can still get that hypertrophy benefit, but in a way in which it doesn't conflict with their means of competing in the sport that they're playing, right? And same thing for like a shot put or someone who requires a crazy amount of explosiveness for like 2 seconds. There's no reason at all to ever go above 3 to 5 reps. And we're going everything super explosive, long rest periods, because we want to optimize for that particular sport and not conflict with anything. Like if Usain Bolt was running miles as his training, those type 2X and those intermediate muscle fibers are probably going to gravitate more towards a conflicting adaptation for their sport.
Yeah, I mean, you can imagine like somebody like a soccer player would benefit from the increased like work capacity in the lower body muscles compared to somebody who needs like high levels of recruitment. So, I mean, that's what's so interesting. Like, it seems like this evidence suggests that the nervous system recruits muscles with task dependency in mind, but it also seemed like this was something that we accepted as a community beforehand. So I'm honestly confused. Why do you think this paper is coming to light now and nobody's really been talking about it for the last few years?
I don't know if many people in the like hypertrophy space read a lot of neuroscience papers, It just may be that, Dr. McMahon is the guy who put it up. And it's also, if anyone stumbled upon that paper, why would they, like, you read the abstract and you're like, what the hell is this talking about?
Yeah.
So maybe it's just kind of like, let's look at a study that's actually testing hypertrophy, But it's pretty cool that we are now moving towards not just like, all right, we did 8 weeks of Bayesian curls compared to preacher curls, and this was the results hypertrophy wise, but trying to get deeper into how does our brain actually allocate those commands, and like how can we train in a way that allows our brain to send as much of a stimulus to the area we're trying to work as possible. And then, so I'd be interested to see more studies. And I don't know how invasive it was for the monkey to have all these things hooked up to him.
Very
But
actually. I
like,
think it was fine wire too. So they were sticking things into their
yeah,
muscles and their brain too.
yeah. So obviously can't probably be done on humans, but it's interesting to think about like task dependency and how that would relate to hypertrophy. I don't know that we need to change our training a whole lot, simply because we already know that the crazy amount of motor units are going to fire when you're close to failure, especially if you are intentionally still have a crazy high degree of effort and you're fighting against something that's a contraction that's slowing down. It's kind of like the whole thing of like a mom lifting their kid or a car off their kid. They can bypass all of those protective mechanisms and just usually they end up tearing tendons and stuff in the process. But like our brain is capable of way more than we give ourselves credit for. And you can see that in a lot of the studies that test RIR in actual failure. Most people, when they think they're 2 reps away from failure, really aren't. They're maybe 3 or 5 reps away from failure, especially if they're novice trainers, right? So novice trainers have no idea what they're capable of. And oftentimes completely, they don't believe in themselves. Like someone who's been, who's gone all out on a set. So for me as a trainer, I have to almost spoon feed intensity at the beginning. And I almost secretly will raise the weights on their exercises and they won't even know it. And I'm like, hey, you just PR'd by 10 pounds on the leg press. They're like, I did? I didn't even know. And you kind of get this ball rolling like, hey, see, you're stronger than you are. Like you're stronger than you thought. And
I'm
then,
famous for doing that with my clients.
yeah, it's a great way to like get intensity without being like, okay, we're going to raise it. And then they kind of have this thought in their head, like, I don't know if I can do it.
And then they'll stop early because they're afraid and they expect that they should have to stop early.
Exactly. Yeah.
Yeah.
So there's a lot of mental components to training. And the fact that we're getting into the neuroscience of it is pretty interesting. And I'm by no means an expert in, that, but I love learning. So especially about this kind of stuff. So to be able to dive into some papers that are recommended by some of the highest level researchers in the game is like, that's why TikTok's awesome. Cause like I can actually have conversations and, pick the brains of some of these like PhD guys and actual foot on the ground researchers. It's pretty cool.
I was so surprised when I started this podcast, like how forthcoming everybody was with information, how willing everybody in this community is to just speak about their philosophy. And I like of everybody that I DM'd and asked to do a podcast with, I think I've gotten like 1 or 2 people say no. And everybody has just been, so like communicative. And that's what I love about this community is like, even though from the surface, like on the outside, if you look at the most popular and the most divisive parts of this community, it looks like a very, very, very bad place. But at the end of the day, like we all really are here because we care a lot about growing muscle and we want to learn how to do that as perfectly as we can. So we're all really trying to reach the same goals. All right. So another question I wanted to ask you is like, the findings showed that some motor units only fired at long muscle lengths and the other ones only fired at short muscle lengths. Do you think that might challenge the idea that a muscle recruits the same way across all joint angles, suggesting like more position-specific motor unit territories than we assumed? And if that is true, could something like stopping a lat pull down around 120 degrees of shoulder flexion actually leave out motor unit subgroups that are like exclusive to the more lengthened position?
Yes, that is an interesting finding that like different motor units fired when the delt was in a shorter position compared to more of a neutral position. And I had kind of like, I've always been experimenting with my training. So like a while back, I was just intuitively thinking, all right, I'm going to train my biceps in the shortened position, in the neutral position, and in the lengthened position, just in case. And so to hear that there may be some truth to that is pretty interesting, to be able to, and it also kind of, in a way, conflicts with neuromechanical matching in the sense that if we can still recruit different motor units in a position where that muscle still doesn't have the best leverage, but if we can still take those motor units to failure, motor units control muscle fibers. And if we're going to get only a certain pool of them in a certain position, but we can access a whole different pool in a shortened or lengthened position, why not try and maximize those? And
Yeah.
so also thinking of the length tension relationship, like I don't by any means know every muscle's perfect range for that length tension. And there's certainly discrepancies between people, like we said, with different mobility issues, I think. But if you think of the length tension relationship as like if it was dead set in stone, like the biceps have a little bit more advantage in a slightly lengthened position, let's say. So we want the resistance profile to maybe be hardest in that range. But if we were to maybe work the bicep in a shortened position, how does that change the length tension of that position? And so it's like, do we want to now train a muscle at a short, mid, and lengthened range, and then maybe change the resistance profile so that we're hitting that optimal cross bridge formation, but at the end of it, the middle of it, and the other end of it?
Well, that's
You know?
interesting. Yeah. So you're saying it's going to be hardest at the same point in all of the exercises, but they're going to be going through different ranges of motion, or the opposite?
I'm thinking like, so like if the biceps tend to have more cross bridge activity in a little bit more of a lengthened position or on the, would it be the descending limb?
Yeah, I believe so.
Uh, then maybe in that lengthened position, the resistance profile is actually hardest a bit shorter. And then when you go to a neutral position, we want to maybe have the resistance profile be a little bit more in the lengthened position. And when you go to the shortened position of the muscle, maybe we want the length tension to be really hard up here, you know? So we're kind of,
You're trying to
we're
get in the middle range of everything on all of the movements.
kind of, yeah, like how can we, like, does the length tension relationship of the bicep change if I'm way up here curling like this compared to if I'm way back here curling like this? Like how would we shift the resistance profile to get it in that optimal cross bridge formation depending on how long it is? That's a question I'd like to ask, like, you know, some of the PhD dudes.
Are you familiar with Dr. Craig's answer to the most optimal bicep curl?
Yes, he is. I mean, he likes to have his arm kind of at 70 degrees, right?
Mm-hmm.
And then have the resistance profile such that it's kind of hardest here, right?
Yeah, yeah. We'll do it hanging, like reverse off of a preacher curl bench. Or he said you can do it on a preacher curl if you like strap your arm into it. When I interviewed him, he said that that would be acceptable as well.
Yeah, I was listening to that conversation and like it does make sense that like on a normal preacher curl, when you get to the top, there's not any tension on the bicep. But and so the other thing too is on the like I have crazy amount of questions about biarticular muscles
Yeah.
because you know there's so many more variables that come into play when you're training. I'm like the fact that the Bayesian curl has shown to be slightly more optimal in certain studies, does that beg the question that having it in that lengthened position just allowed it to have tension on shoulder flexion and elbow flexion? And that more stimulus kind of allowed for more recruitment. And like I've been trying to train my rec fem in a lot of different ways too. So like I don't know if you've seen the exercise I do where I have like crazy amount of knee flexion and hip extension with a cable attached to my ankle. And I'm basically
Yo, I tried to replicate that and I looked like such an idiot. I looked like such an idiot when I tried to replicate it and I gave up.
so like the big thing I know is that if you're training, like for instance, if you're trying to train hip flexion for the rec fem and the like you're doing it on a leg extension machine with the pad above your knee, I don't think there's going to be able to get meaningful engagement from the rec fem because there's no tension on its other action or rigidity on it. But would an optimal exercise for a biarticulate muscle be kind of performing both of its actions simultaneously? And how would that affect regional hypertrophy amongst it? You know, so like I have two thoughts with rec fem. It's getting into a crazy amount of hip extension and knee flexion and doing basically hip flexion and knee extension simultaneously because they're working the rec fem through hip flexion and knee extension at the same time. Or would I just kind of cuff below the knee somewhere and do straight legged hip flexion without any knee movement at all?
See, I would assume, and this is just my uneducated guess, I would assume that separating them would be better just because whatever motor units are exclusive to either one would just be hit during that, right? Unless just doing it together would somehow inherently make different motor units active.
Yeah. So I'd like to see studies on like if you just, even activation studies would be interesting to see, you know, put like 3 diodes or whatever for EMS on the distal portion of the rectum, the mid length, and at the more proximal region, and just do different hip flexion exercises. Try it above the knee, try it below the knee, try adding in a little bit of, and with biarticular muscles too, like just because my hip is extending and lengthening out that muscle and the knee joint is moving too, like which end is getting longer? Because it's not going to be the same, you know,
Yeah. This
it's
kind of
like,
reminds me of the long head, like, because like the long head's kind of like the rec fem of the arm. I feel like so like when people are doing like their tricep pullovers on
yeah.
like a Nautilus machine or something where there's no tension on the elbow at all, there's no torque at the elbow, and all the force is going underneath your elbow. If you're in these top ranges of motion, I feel like the only muscles that could possibly be doing that are the pecs and the lats, and honestly, that might explain why we don't see that much growth, I guess, anecdotally from like extreme ranges of motion in like pull downs or rows, because maybe we're using more of the tricep when we have like an attachment at our hand, as opposed to maybe if we had like some type of cuff here and we could just do extension from high degrees into over here. Maybe the lats
So
could actually be more active there.
I think so the difference between doing a Nautilus pullover, top half pullover, right, and having your
Yeah.
elbows on the pad,
Yeah.
I think that's going to be pec and lat almost exclusively.
Yeah.
But if you were to remove the pads and only hold the bar,
It would be triceps.
now we have tension on elbow extension too at the same time. So like I had a question for like, you know, Rowan EMG, the guy who does like EMG studies. I wanted him to test like doing, you know, people do like top half pullovers for their tricep. But a lot of people will cuff here, and that's where I think they're wrong, right? So like I don't think you should cuff here. You should at least have the cuff above your elbow so you're getting pulled into elbow flexion at the same time. The other thing is where that elbow's pointing, right? So if I can get more, I kind of put a little bit more weight into fiber orientation than some people do. Like a lot of people will do straight shoulder flexion for the upper pec, but those fibers run pretty diagonally. So I think you have to have some sort of adduction component to it to really kind of bias that area more. But yeah, so like talking about the long head, I think it's best if you were going to try to train it in its action of shoulder extension, you'd want to go into high degrees of flexion with the cuff somewhere up here, elbow turned this way, and you're basically pulling this way. But now my other thought is if we could basically do both at the same time, would that elicit more activation across a broader spectrum for the tricep?
See, that's reminding me of like, you know, the old school push down that people used to do, like the Sebastian Burka started doing recently again.
Down?
Yeah, it's like a push down where you bring it up and I found that difficult to wrap my head around just because, like, does it matter what degree of shoulder flexion we're in? Would that impact whether or not the long head is being active? Because I can only imagine that if we're doing that movement, if we look at the humerus and what's happening, it seems like identical to a row. So it's like, I understand that the torque is coming from a different place, but it's harder to wrap my head around whether or not that would actually be a good tricep exercise.
I think this is like one of those situations where the internal moment arm would make sense to kind of include as a variable, right? Like don't like if the moment arm of the long head of the tricep is going to have a bigger advantage up here, then I don't think it would make sense to try to train it here because this like here to here is going to be mostly lat, right?
Wait, hold on.
Maybe.
Didn't you say the long head has, sorry, doesn't the long head have better leverage in like anatomical position though?
For elbow extension. Yeah.
Oh, right. Not for shoulder extension. Okay.
But
Okay,
for
my bad.
extension, I think it's better up here. Yeah. So it'd be kind of cool to like, I see the future of equipment design being pretty incredible because if we could have for instance, like a pulley system, you know, those like things that you can hook up and like you can add resistance and you can move them anywhere you want. If you
Yes.
could
Yeah.
have, if you could have one that during the rep could actually move up and down, like if I was, it's hard to explain, but like you could change where the force is coming from during the rep itself. That would be really interesting because you could totally keep the resistance hard throughout the whole movement if you wanted, you know?
Yeah, because say you were doing your like rec fem extension, you had it behind you. Say maybe the stack was a little bit higher.
Down.
Yeah, yeah, that would be a
Yes.
fire. That would be that's the only problem with your setup. Yeah,
Yeah.
yeah.
Because it's going to be super easy at the bottom if the cable's way up high. So like, do I do one way up high, one down here, and one down here? Or if I could have a traveling cam that like went on a track and actually made it so that that cable's at 90 degrees to my femur or whatever the whole time.
That is amazing. Yo, I might cut that out and come up with it myself.
Yeah, so I think the future, like, and we're all already seeing like with the tonal machines, the ability to change the amount of resistance for the concentric and the eccentric. So like you're pulling 200 pounds this way, but it's 300 pounds on the eccentric. Like, and then you can also change progressive repetition so it gets harder as you go, things like that. If you just have like a freaking crazy cable machine with like 5 of those cams with different tracks that could go in different planes, man, you could literally, the possibilities for exercise selection would be endless, and the specificity too, you know.
I can only imagine how difficult that would be to set up though, because that would have to kind of be tuned to your own like anatomical structure, right? In order to travel the right distance. Yeah, we're gonna need some
Yeah,
AI in those machines.
right. I mean, who knows, with the way technology's flying, man, we could have some pretty crazy stuff.
That's true. With the exponential growth of technology, maybe in 5 years we'll see it. So like if descending control is multidimensional and cortical microzones can bias motor unit subsets independent of like biomechanics, where do you see neuromechanical matching fitting in? I know we talked about this a little bit, but do you see it as still like a useful tool in most cases, or it's a too oversimplified of an explanation for us to be using it on most of our exercise selection?
I think it's, you know, my stance, I always try like to not put myself in a camp of like, this is the way to do it. But I think internal moment arm length has merit when it comes to trying to figure out where I should train a muscle. I don't think it should be like the number one thing. I've kind of gravitated a little bit more towards the
Length
optimal
tension?
cross
Yeah, me too.
length transfer. So like if and the whole thing is like either chasing motor unit recruitment or are we chasing internal fiber forces? Because they do relate to each other. But if we can get our muscles in their happiest place where they can produce the most force and really challenge them there with the resistance profile that makes it hardest through that range.
Yeah, why wouldn't they turn on?
Yeah. And then maybe there is on the other end of the spectrum, challenging a muscle where it doesn't have very good leverage in order to get those other motor units that aren't firing during optimal cross bridge. Maybe there is some merit to that. So I'm not saying that I'm going to hit every muscle in a shortened mid range and lengthened position, but maybe on some areas that you want to bring up, there's some merit to playing around with some of that stuff. Like for instance, my triceps, right now I'm kind of having fun just kind of going to town on my triceps. That's the other thing. So, you know, Newton extensions, right? Well, I have an interesting theory on the long head in a Newton extension, right? So if you need meaningful tension on both ends of the muscle to kind of work a biarticulate one correctly, in a Newton extension, right? So you're like, my arm is cupped here and I'm pushing into it for stability, right? If I'm pushing into this, I'm firing my front delt and upper pec to kind of stabilize.
Yeah.
Does that reduce the force on the long head's role of extension in that? So I think that, and I've been playing around with this, I'm just doing like a normal cross cable push down without any stabilization here because I feel like having the tricep also stabilize its other role may be more beneficial. You know what I'm saying?
Yeah, that
Like if I'm and that might also be why Bayesian curls have been shown to be a little better than preacher curls, because in a preacher curl, you're essentially pushing your arm down into the pad, into shoulder extension, right? So
yeah.
kind of turning off the biceps need to be flexing at all, or the shoulder's ability for the bicep to be flexing. So
So
I've been doing,
how are you changing the setup exactly? I'm trying to get it.
so I was doing Newton extensions for a while, but I would almost feel as I get close to failure, my front delt almost cramp up because I'm pushing into the cuff so
Yeah.
hard.
Did you change the setup though? I thought you were saying you changed the setup.
So I'm just taking the cuff away and doing a normal extension now because I
Okay, okay.
think having a little bit more force on the triceps extension shoulder extension while I'm doing elbow extension may like we said, activates some of those motor units that are responsible for shoulder extension during the
That's
movement.
interesting. So what's your thought on like a Carter extension where you face away from the cable stack?
Yeah, I think that's great. And you're not hooking your arm up to the column, right?
No, no.
So so there is some force pulling you into shoulder flexion while you do
Yeah.
it.
Yeah.
Albeit maybe it's not as much because you're right below the pulley or right behind
Yeah.
it a little bit. But I think that would be pretty much a similar movement. But I've also been doing so I've been doing the just a normal push down, and I've been doing kind of a descending cable JM press where it's hardest right here from behind me. And then I'm doing kind of I call it an ascending JM press, like people call it the Quinton extension or whatever, the Quinton press, where I'm actively basically like a tricep thrust, where the cuff's here and I'm pushing into. So basically working the medial and lateral head in their really shortened position. Like the resistance profile is really ascending there.
Would you say the JM's really descending or closer to descending than it is like bell curved?
Totally. Because at the top of the JM, no matter what, there's not going to be any tension. It's basically going straight through the joint, right?
So is there any reason that you don't do any like mid range work for the medial and lateral head, or are you looking to add that as well with like maybe like an overhead extension or something?
Well, I'd say like on a JM, I mean, it's not going to be super easy here. It's
Yeah.
going to be really easy once you lock out. So
Right.
like, I think kind of lengthened to mid range is going to be
Yeah.
good here. And then the ascending one just makes it super hard through the mid and shortened position. So I think I
Yeah.
cover most of the resistance or every resistance profile I could get there.
Yeah.
And I'm just kind of doing it for fun right now because I kind of want to just pick up my arm size. And so my biceps are pretty decent, but my triceps, I think I've always lacked a long head because I just never really focused on training them that much.
Yeah. So are you doing presses or are you not doing any presses anymore because you got the butterfly with you?
Yeah, for pecs, I'm basically just doing like a straight across cable fly, kind of lower pec, internally rotated fly, and then a clavicular head kind of fly.
I noticed that you started doing a frontal plane lateral raise, but I think the first time I commented on one of your posts was when you made a video about doing like a scapular plane raise
Yeah.
for the side delts and then doing a raise like with your arm slightly behind your body for like going a little bit backwards for more like the mid to rear delt. Is there any
Yeah.
reason
So
why you decided to incorporate just a pure frontal plane raise?
Well, I'm not doing a pure frontal plane. I think someone was saying, what would you choose between the Y rays because a Y rays is going to basically kind of target more the posterior section of the side delt, along with kind of lower trap and maybe mid trap a little bit. Whereas a scapular plane is going to be because there's a little bit of shoulder flexion and scaption here. So it's going to target more the anterior portion of the side delt. So between those two, I think I'm good. But if I maybe only had one option, I would probably do more of a strict frontal plane
Right.
raise just because that's going to target right in the center of the mid of the side delt. But
Interesting.
I've also started doing a top half shoulder press the last couple weeks here that I'm kind of playing around with, which will get a little bit of the side delt too, but mostly that front delt at that top half.
Yeah, I love behind the neck press, man. I've always been a behind the neck press lover.
Yeah, if you can, so that's the thing is like if someone has poor range of motion in their shoulders, like if they can't get back here, oftentimes what you'll see is people trying a behind the neck press, but they're leaning really far forward and they're basically coming into this position here and they're just asking for an injury. But I think there's nothing wrong with behind the neck pulls or behind the neck presses if you have the range of motion to get there.
Do you think it's worth people like working on trying to get that range of motion if it's not coming naturally to them, or you think in most cases you're fine just staying in the semi frontal plane, like going in a little bit of scaption?
Yeah, I think it's totally dependent on the person, right? So like what are their goals and why are they trying to get a behind the neck press? So yeah, it depends. I always kind of say, as far as like range of motion and mobility goes, like nobody should just be chasing as much mobility as they possibly can get. We should be chasing the amount of mobility we need for what we do in real life, and maybe a little bit more just in case we get into positions that we usually don't get into. There's so many people that fall and they'll tear a quad tendon because they don't have any knee flexion or their quads are so freaking tight that they can't even sit on the floor with their butt touching their heels. And if they do, they're screaming in their knees. So if we can open up that range and get them more accompanied with, and the other thing too is like when it comes to gaining mobility, there's this thought that when you're getting stretch mediated hypertrophy, you're actually adding sarcomeres in series. So that muscle is actually getting longer. But the other big component to actually increasing mobility is desensitizing your brain to those ranges of motion, because the Golgi tendon organs and the muscle spindles are there to protect the muscle and tendon from getting too far lengthened out or being under too much tension. And so we're essentially desensitizing the nervous system to understanding it's okay to be in this much knee flexion, or it's okay to be in this much hip flexion. And you just give it a little bit of taste of those lengthened positions over time, and the nervous system kind of goes, oh, we've been doing this long enough now to where I don't have to be protective in this at this joint angle anymore. And then you attack it a little further, and you're not really making the muscle longer, you're just desensitizing the nervous system to those end ranges.
I think that's why so many people mistake static stretching to like increase their stretch mediated hypertrophy, because then after doing it for a while, you can feel you get like a little bit more range of motion. And it's like, well, I must have increased sarcomeres if I can get more range of motion.
Yeah.
But in reality, it's just, you've always been
yeah,
able to do that.
Right. Even like adding a few sarcomeres in series, how much is that really going to give you as far as range of motion goes? I think you get way more of the range of motion purely from desensitizing the nervous system and some of those mechanoreceptors around the joint and the muscles to not be afraid of going into that position anymore.
So to my understanding, like orthokinetics is pretty big on like tailoring movement to the lifter's structure. Do you think that the brain's ability to route different motor unit subsets supports the idea that there's like no single like optimal form for an exercise? There's really only optimal form for that person and their structure? Or do you think that there are certain things that we can point to that are going to have to be standard for everybody?
I mean, although there's obviously variance in anatomy between humans. There's differences between biological males and biological females. There's differences in origins and insertion points. And you also have to take into account what that body has been through throughout its life. Like if someone's been in 4 car accidents and their joints are all messed up because of that, there has to be adjustments. We're going to have to find the optimal way for them to train, you know? So it depends. I think, yeah, when you look at like a normal, healthy human, the technique for a bench press should be pretty close to the same. There's not going to be any wild variance in certain exercises. But I think technique is not super person to person dependent. I think that there is kind of a technique you want to get them to. But like, for instance, if I'm trying to get someone to do a pure horizontal chest fly, but their supraspinatus is all screwed up and it hurts to go into that position, obviously, and they can do it fine here, that's going to be perfect too, you know, like for them. So just kind of, I think when it comes to exercise technique, it is very person dependent and depending on where their current range of motion is. Not to say we can't strive to improve those certain joints that may be limited to get them to that really good technique eventually. But it's like, it's always, is the juice worth the squeeze here, right? So like, do I want to spend my full hour on someone trying to correct a joint, or do I want to try to maybe get a little bit more out of it and then go hit it in a way that they can get the muscle growth, which is probably what they are going to benefit from more.
And I wonder like if poor movement quality could be like a result of the CNS, like over relying on a narrow set of motor unit subgroups as opposed to like accessing the full pool. And I wonder like if you refine somebody's movement pattern over months, like are you changing what motor unit territories are capable of accessing?
I would say 100%. So like when we first start learning how to move, like I have a 4-month-old son, and I can literally see him like figuring out that he can control his hand. It's like so cool to see. Like he'll stare at it and I'm like, he's like literally figuring out proprioception and stuff like that. But when you see babies develop and they start crawling, you'll see a tendency for them to like use one side more than the other. Or when they first start going up steps, it's like right, left, right, left, right, left. So from the very beginning, we're building up these movement patterns that may be more one-sided than the other. And in doing so, we are strengthening our brain's connection to that movement in one direction, right? And over time, if we continue to be very dominant on one side, like when I'm training soccer players and they have a foot that they tend to kick with, I can just look at how they stand and tell them exactly what their kicking leg is and what their plant leg is, just based on like their foot external rotation and their pronation in the foot. I'm like, you kick with your right leg, don't you? And they're like, yeah, how'd you know? I'm like, well, when you kick a soccer ball, you're externally rotating, kind of everting your foot a lot. and your brain has kind of driven that into what your posture now looks like. And so, yeah, I think the way we move completely dictates what position our bodies are in and where our body likes to sit. But there's a really famous Olympic level high jumper who had jumped off I think it was his left leg for decades. And he was one of the shortest guys to jump the highest height. So, like, as far as height to high jump height, he was like one of the best in the world. But he ended up hurting himself and could not find a way to get back. So he taught himself to do it off the opposite foot after like 20 years of doing it, and was able to get back up to an elite level. The fact that we are so capable of adaptations, you have to put in the work to fix it, you know? And so you are, to some degree, rewiring the way your brain recruits motor units. And some of them may be dormant on one side because you're so used to using everything on that right side that the left side is just uncoordinated and doesn't know how to control them, or hasn't had enough time sending those signals and those repetitions to build the proper movement pattern. Because the movement patterns are like, you know, we don't really think about it, but when we're walking down the street, we're literally recruiting so many different things at once without thinking about it. But if we build up these tendencies and poor movement patterns over time, it can cause big problems in our joints.
So based on everything that we talked about, what do you think the most important, I guess, mobility restriction bodybuilders should be worrying about, that they should be working to try to address before it becomes a problem?
That's a good question. So I think if you were to take the average hypertrophy-based lifter who tries to go off good principles, training that way will, in fact, make your mobility pretty good, right? Because you are working a lot of different joint angles with different resistance profiles. So I don't think necessarily, it's more the average person who doesn't train on a regular basis that has very common things built up in them. So, like I said, I train a lot of general population who don't care about having big muscles. They just come to me because they're in pain, or they just want to get in shape or whatever. I can tell you that most people that work at a desk, they're really good at protracting their shoulder blades. They're not very good at retracting them. They're really good at shoulder internal rotation, but they suck at external rotation. Their hips are really good at flexion. They suck at extension. Those are like the big ones I see in most general population people. But I think training for hypertrophy takes care of a lot of those things in itself. So I would say the average bodybuilder, if they're training most joint actions through a big range of motion, they're going to be fine. You know, like, it's a great way to keep your mobility.
Yeah,
they probably don't need a ton of added work unless they have something going on at certain movements. Then we can address and kind of analyze, like, where are your limitations? Are you limited in abduction, external, internal, protraction, retraction? How do we get the shoulder blade and the humerus to kind of work together the way they should, you know?
The only thing I've seen to like really bother bodybuilders after like a long time of training is like, I find that a lot of science-based lifters get like so obsessed with progression to the point where they try to chase that above everything else, and then they just build like really horrible technique to exercises, and then they just reinforce that horrible technique. Like, personally, for me, like, when I started lifting, I started with powerlifting. So I was doing bench, squat, deadlift every week. That was just how I started. That was really what my friends were doing. So that was how I got into it. So I learned how to bench press, like, they told you how to bench press in 1975, you know, like, retract your shoulder blades all the way back, keep them down the whole time. And I built those like horrible movement patterns. And then once I started getting into science-based training, like 17, 18 years old, still a baby to training. Like, I just started doing the chest press the way I would do the bench press. And then before you know it, like, on every single pressing movement I do, I have this excessive like rib cage compression. And it's so hard to fix that after you've already developed it, that I just feel like that is the one thing that bodybuilders suffer from the most, is getting so obsessed with getting stronger that they forget that they have to get stronger under the same conditions and the variables have to stay the same.
For sure. And I think, like, to some degree, bodybuilders also have a tendency to want to just gut it out and push through the pain.
Yeah.
Meanwhile, they're almost driving in these poor movement patterns
Yeah.
that are, like you said, hard to rewire to some degree. And then you catch yourself kind of, I don't know, like, skipping an exercise because you don't want it to hurt. And then you're not really doing anything active to correct it, you know? So it's kind of this thing that kind of keeps flaring up every couple weeks. And you're like, man, I can't bench because my shoulder hurts or whatever. So yeah, there's some merit to that, I think, is just not addressing a problem when you first feel it and being in tune with your body, and chasing numbers rather than having more of a zoomed out perspective on your fitness. Like if hypertrophy is the only thing you train for, you may be missing out on long-term gains because of the fact that what future injuries are you like kind of
Yeah.
setting in stone, you know?
Dude, this was incredible. Thank you so much for coming on and sharing your perspective. Everyone listening, please give him a follow. Do you want to drop your socials for anybody? Are you on anything other than TikTok?
I'm thinking about getting a YouTube started because a lot of the content I make is kind of longer format, or I would like to make more longer format. So I do have a YouTube with no videos. It's called Trainer QA, and that's my TikTok handle as well. That's where I kind of do most of my stuff right now is TikTok. So yeah.
I'll throw it up on the screen for sure. All right, guys, if you learned anything, make sure to drop it in the comments. See you guys in the next one. All right, just give me 1 second.